All right, this is my audience.
Whoa.
I'm Carrie Gerling, and this is my presentation for my public speaking class, my first one. I chose my presentation to be on the global issue of meeting the health care needs of the vulnerable population, specifically that of the homeless population. Modern health care is ever expanding in the area of community health and public health settings. This change is recognized primarily through shorter hospitalization stays and an increase in outpatient settings. Likewise, when you think about this, caring for the vulnerable populations and homeless populations, our goal is to eliminate healthcare disparities among many groups. This is a common goal among many healthcare agencies. However, despite all the efforts that are put into trying to eliminate these disparities, the United States has seen an overall increase in the vulnerable populations, and according to the National Coalition for the Homeless Population, we've also seen an increase in the homeless population. So how can we strive to better meet the needs of the homeless population? To answer these questions, I will discuss some statistics on what the problem of homelessness in Springfield. I will talk about what exactly a vulnerable person is, talk about the health care needs and access, and health literacy of clients. And then I will discuss some different nursing strategies to better meet the needs of these clients. A vulnerable person can be described as those who are at risk for poor health care and susceptible in areas of physical, social, psychological well-being. Examples of such populations would be the poor, the homeless, pregnant adolescents, substance abusers, victims of violence and domestic violence, the mentally ill, and people with communicable diseases. If you think about this, the homeless person is at risk for all of the above. And along with being at risk for all of that, the rates of chronic health and health problems are very high in the homeless population. As you can see on this chart here, in the different counties of Missouri, it shows the different areas of the amount of unsheltered homeless people. In Greene County alone, there's over 287, very large number, and this graph shows compared to the national average of Missouri, comparing men and women. There's a reported over 47,000 homeless people in America, and 20 to 25% of these people are mentally ill. After working at the Victory Square, I have seen this firsthand. So when you think about healthcare needs and healthcare access, many times these needs are unmet. As a result, these individuals will receive a poor quality of health, making it increasingly important to bring these specific healthcare issues to the front. One of the biggest concerns is lack of medical insurance. Many Americans go without primary care, and others struggle to afford prescription medications. When you think about the homeless, they don't have health insurance, and they do not have the financial capacity to pay for medical services. So this, in turn, makes it very hard for them to get the care that they need. And you think about the very high rate of chronic medical problems, they are more likely to delay treatment or have non-compliance with the medications that they need. This often leads them to the emergency room when their condition has gotten to a point where it's life-threatening, which makes them have to stay in the hospital longer and unable to meet the needs that they need for a good quality of life. Another treatment, as I said, was treatment for mental illness. And with medications, they don't receive them. So when you think about the homeless population, where the health problems are abundant, the access is very limited. Finding health care is nearly impossible. Many are more concerned with meeting the basic needs of food, shelter, and clothing, rather than the other parts of their medical care that they need. So, also, if you think about lack of funds and transportation, also another barrier to access. Typically, homeless people are at the mercy of shelters and soup kitchens for survival, so they don't want to go to a waiting room and sit and wait for hours because they'll miss out on being able to do what they need to do. All of these factors contribute to limited access for care to the homeless people. And this came from hhs.gov, 2010. From nhchc.org, the clinics that address the issues of housing, jobs, family relationships, and substance abuse help this population. And the concept itself seems to be good in nature, but the execution of such is very poor. This could possibly be from the lack of the economy, the lack of resources, and it seems like this population is one step away from a healthcare crisis. According to an article by Smith in 2003, health services at the community level are organized and financed in such ways that men that need access can get access but encounter barriers to care, such as poor service design, lack of insurance, and the absence of health literacy. That brings me to health literacy. Health literacy can be defined as multiple different things. The Healthy People 2010 describe it, the degree to which an individual has the capacity to obtain, process, and understand health care information. Low literacy can potentially reduce the success of treatment and increase the risk of medical errors. And clients with low health care literacy are at greater risk for medical errors, poor quality of services, miscommunication, and inability to access clinical trials. And if you think of all the different things you need, in regards to health literacy, you have to be able to make doctor's appointments, give informed consent, and follow directions properly. On here, I have some different strategies for meeting healthcare things. And on another note, the National Institute of Medicine reports that over 90 million people in America have a problem processing and understanding healthcare information. So that just gives you an idea of the problem with it. Well, when it comes to health literacy, some nursing strategies would be health teaching, counseling, screening, case management, and advocacy, which is very important. We also want to do written teaching. You want to keep the language at about a 5th grade level. You want to keep it in short sentences, use large fonts, and have single teaching sessions. When you think of health teaching, it helps with prevention, which is key in any type of care. You also want to keep them modifiable depending on the health literacy of the population and the clients that you're working with. So all in all, when you think of the common risk factors along the homeless population, these vulnerable population have an increase in risk factors for many health concerns. They have many barriers to receiving the proper health care. So when you think about that, you want to keep these nursing strategies in mind, and you want to provide health care to them that's tailored to them. Now, many clients will I need you to have an open environment for them to come to you. But they also need to be responsible for their own care, and that ties into the framework of self-care. So in order to fix the problem, you have to have a better understanding of what the client is going through and know your resources. Thank you very much.
Was it good? Really good? So I can play.